Hi, my name is Dr. Kiran Kinger. I am a UK certified consultant pediatrician. I look after babies and children and I'm working in central Bangalore, and I have my own clinic by the name of Dr. Kiran Kinger's Kids Clinic. And today I will be talking to you about some common questions parents have regarding their babies and children. Talking about starting solids in babies, although the ideal time is when the baby is ready. So when is actually a baby ready? Approximately 6 months is the correct age. So if you are able to start smooth, soft baby food around the 5th or 6th month, then the baby will get adjusted slowly and build a taste and appetite and enjoy the baby food, in addition to continuing feeding. Breastfeeding should not be stopped because that is still very good for the baby. However, there are some myths and misconceptions that if you start the solids early, the baby might develop a lot of allergies. That is partly true because the baby may not be able to digest and absorb the food comfortably. So as soon as the baby is not able to adjust to the food, simply you slow down the baby's solids weaning. So therefore, once the baby is matured a bit, you can start the baby food again. So I prefer that you start around 6 months age, which is safe and also well tolerated in the babies. The next topic is around vaccines. There are some myths and misconceptions stating that giving too many vaccines will affect the baby and load the immune system. So to that, the answer is the myth and misconception is just that. It is a myth and misconception. A vaccine is a prevention. A prevention is nothing but trying to avoid disease. So actually having to deal with the disease is more disastrous. So preventing the disease by using a vaccine is the ideal situation in babies and children, especially when they need it. So vaccines don't give any harm. In fact, they do some protection. So vaccines are nothing but a means of giving protection to the babies, and there is no question of immune overload. It's a question of giving immunity and protection. So vaccination is protection of disease in children. The next topic we'll be talking about is teething in babies. First of all, teething is a dental development. It's not a disease. So teething does not cause fever. Teething does not cause loose motion. Again, this is a misunderstanding and a myth that teething will cause fever, teething will cause pain, teething will cause loose motion. Yes, I agree, teething can be discomfort or little bit uncomfortable for the baby initially. The best age for teething is around 8, 9 and 10 months. Generally, the baby is much bigger and able to tolerate a little bit of teething pain because baby has started to use the mouth quite well by now. So I think teething does not cause any disease or side effects. Teething is a natural dental development, and the fever and the loose motion which happens during the teething age is purely coincidental. Now we are going to talk about picky eaters. There is a question here which states, how can parents encourage their picky eaters to try new foods and ensure they receive proper nutrition? My child doesn't eat is a very favorite complaint among many parents. So the only way you can get your child to try something new or try something different is to show by example. So if the parent, mom or dad or grandpa or grandma encourage the child by exactly showing them how they are going to eat the item, they will at least learn by example. So if they can do a copycat, okay, you eat a piece, I eat a piece. You try again, I try again. So this is a way to encourage the child directly one-to-one. And I think trying to achieve a proper nutrition is to allow the child to feed himself or herself. Because if we take control by feeding them or forcing them, it doesn't work. It causes more harm than good. So do not force feed, allow them to self-feed and encourage them by setting a good example. The next topic is regarding teeth care. Dental health or hygiene and avoiding cavities is a concern amongst many young children. especially those who love to eat sweets and chocolates. So many parents ask this question, how do I ensure my child has a good dental hygiene and I can avoid cavities? So the answer to that again is about setting a good example. So if the parent also does brushing the teeth twice a day, first thing in the morning and last thing at night. So brushing twice a day is very important, and using the same toothpaste as the family, a smaller quantity, just a pea size of toothpaste. And if it is started at a young age of 1 year or 2 years, then what happens is the child will get into a habit of daily brushing morning and night, and the chance of dental cavity is less, infections are less, the oral hygiene is good. So I would say encourage brushing of teeth twice a day and show the example by you also doing the same as a mom or a dad. Now I'm going to talk to you about pacifiers. Now there's a question which is confusion rather. Using a pacifier can interfere with breastfeeding, and what are the potential benefits and drawbacks of pacifier use? So talking about pacifier, it simply means that word, means pacify. So if the child is irritable and very difficult to settle down, a pacifier can be used temporarily for a few minutes or for a few hours sometimes, but to pacify the child. It is just a means to try to help the child to be calm and also to help the parents to manage the baby better. It won't interfere with breastfeeding, and neither will it cause any harm in the long run. So it is a temporary use just for comforting the baby, and a pacifier, as long as it is clean, is very safe and effective. No problem. The next topic is about a very epidemic proportion use of screen. For example, children use phones, iPads, mobile phones very frequently. They watch YouTube videos for a long time, and many parents are concerned, what is the latest recommendation for screen time in children? And I think it's a very difficult one, but it's an important one. So my recommendation to almost all the families is to limit the use as much as you can, but even if they use it, take breaks. Say for example, they use the phone for 10 minutes. Please take it off them for a few minutes. Then they can use it for another 10 minutes or sometime. But long period of hours causes strain, causes a lot of side effects, causes difficulty in concentration. They will not enjoy their regular play, outdoor play activities. So I think we should work very hard to try to limit the screen time to as minimum as possible. There is no safe number as 1 hour is okay or 2 hours is okay, because there is no studies done to prove that. But I will say that even if they do use the phone, use it smartly, use for a short time, take breaks, and avoid long-term use and harm. That is my advice. And my location is very easy because closest landmarks are Coles Park and Santosh Hospital. I run my own clinic and I look after babies and children of all ages. I have an independent practice of pediatrics and child health in Bangalore. Thank you. Medical emergencies are completely uncalled and unpredictable. One family can have a medical emergency at any time, any hour, and therefore will need enterprise such as Medi-Talks to provide their emergency support. Medi-Talks is one such organization which is trying to help people with immediate ambulance access, help during the medical emergency at the right hour, so that the patient can be supported and transferred to the right place for the best care. So Medi-Talks also provides home care services across Bangalore, and if you have any need during any emergencies or even regular medical work, please contact Medi-Talks team. Thank you.